Hello and welcome to a pretty special episode of A Lot of Big Changes. This is not going to be about cooking, cleaning, crafting, or reading. It's going to be about a very big change that I just had this week. Today is August 20th. On August 18th, I had a full vaginal hysterectomy, meaning they took my cervix and my uterus, not just the uterus. And then I also had a bilateral victomy, which means they took my tubes. So I do still have my ovaries. I shouldn't be experiencing any hormonal shifts, but that was my big change as of lately. And something I noticed when I was looking for YouTube videos about people's experiences with vaginal hysterectomy specifically, I could not find any. Every single video that I found was from a medical professional of some kind, nurse, doctor, surgeon, some sort of medical professional. I couldn't find anything from a patient's perspective. And I don't know if that's because, vagina, bad word, or if they're just not that common. My doctor said that they probably just aren't that common because most people aren't trained on them anymore. Once they found, as she put it, once they found out they could do laparoscopic or even robotic assisted, people just stopped learning how to do the vaginal kind. However, she did say it's one of the most clean, let's say. Like, there's less complications. You only have the one set of stitches. I don't have any scars in my tummy. I just have the one inside, which obviously I cannot see and it will not show. She described it as it's now the toe of a sock. So the top of my vagina is just sewn together and it'll basically just end. There's no cervix. So I want to tell people about what this was like, so hopefully other people know their options as well, because I was a little nervous going into this because I didn't know what to expect besides the very clinical instructions I was given. So a little bit of background on me. I'm 31. I have had gnarly periods my entire menstruating life. I got my first one at 12 on August 7th, and I got my very last one on August 7th. That's really funny to me. The only reason I remember this as a family member's birthday, and I got my period at the restaurant when we were having a birthday dinner. And then, obviously, I was tracking it with this last one because I was a little worried that it would interfere with the surgery, which she already said, no, it's not. Anyway, I got it at 12, had periods so bad they would make me puke and make me feel really ill, got on birth control at 18, got off birth control at 26 to prepare to get pregnant, didn't conceive, or didn't even really try to conceive for a while because I was not ovulating regularly. I come by it honest, I have 2 generations of gynecological issues behind me, so I had to go on metformin in order to get my ovulation to go regularly. We got pregnant first try. Pregnancy was normal. Delivery was normal. I got my period back at just over 6 months. And I completely bled through a super tampon in like 6 hours, like into my pants. And I was like, oh, okay, well, it's my first one. There's probably a lot in there. And then the next one, and then the next one, and then the next one. They were staying heavy. I'd have like 5 super duper heavy days to the point that I was having to use these. That's an ultra tampon. It is literally the size of my thumb. Those are supposed to hold like 18 mils, I think, 18 to 20. And I talked to my doctor about like, hey, I'm still having super heavy bleeding even a year postpartum. Can we do anything about that? So she gives me something called tranexamic acid, which you only take during the period, and it's supposed to lighten it. And it did. It did lighten it. So I went from 5 super duper heavy days to 7 heavy days, 9 heavy days, 15 heavy days. That was the longest one I had, was 15. And this was, honest God, ruining my life. I was irritable. I was always in pain. Like, I have basically chronic pelvic and back pain, which I assume are related to this. I really don't know. And then I was like, okay, this isn't helping. This is actually making things worse. And she's like, okay, we'll try an IUD. So I tried an IUD, and then I bled for 4 months straight with like a day here, a day there where I wouldn't have anything. And we're not talking the brown gunk that I was told. We're talking bright red, beautiful, fertile blood for 4 months straight. So I had that sucker ripped out. And then I was told just give it a minute. We'll see if that helps. And it didn't. It stayed the same, heavy but long. And then I was finally like, I want an ablation. She's like, okay, we can do that. I had to do an ultrasound just to make sure everything's okay. No cysts, no fibroids, nothing on camera. That should make this bleeding make sense. She's like, okay, well, we are kind of worried about cancer at this point if you don't have a reason. So we're going to take a biopsy. Biopsy was weird. If you ever need a uterine biopsy and they have the nitrous oxide for you, please take it. I felt like I was on a different planet. It felt weird, her rooting around in there, but it didn't hurt until later. So, cancer screening came back completely fine. Nothing happened. And so she asked me, do you want the ablation or do you want a hysterectomy? And I told her, after some of my own research, I have read about women who their endometrial lining grows back after an ablation and they end up having to get a hysterectomy anyway. So I would rather, because I'm firmly in my childbearing years, I would much rather just get rid of it. And so she said, okay, we'll set that up for you. They set up a date. They set up a pre-op appointment. I had to sign a bunch of consent forms. I had to have it explained that you won't be able to have babies. I'm like, yeah, that's kind of half the point here. But the anxiety was very, very real for me. I was so upset. The day before, I've been waiting for this for 3 years. And the day before, I told my husband, I don't want to do this anymore. I'm really scared. And I did it anyway. So here we are. So the setup for all of this, I got to the hospital at 8 because I was supposed to check in at 8. Surgery's at 10. I get in, I pay what's left of my copay, then go up to the OR on the 3rd floor. This is at Banner Hospital in Tucson, and proceeded to cry to reception because the panic just kind of finally set in for me and I could not help it. Just not boo-hooing, but just one of those. And she was so sweet about it, gave me some paperwork. And then she's like, okay, we need a urine sample and please go brush your teeth. So she gives me a little cup and a toothbrush and all that. And she's like, and you're going to have to keep the urine with you. I was like, oh, sexy. And that just kind of did it. I wasn't anxious anymore. Being stupid makes me not anxious. So I waited for about an hour, I'd say, until they finally called me back. They weighed me. They had me clean myself with these wipes. They took my glucose just to make sure I'm not diabetic. Or they did my blood sugar. I guess glucose is blood sugar. They did my blood sugar with just a little stick, and it was perfect. And then they had me get into a very attractive hospital gown. Huge. The thing was so big on me and itchy. And then they had me get in this very luxurious hat. And then it was just hurry up and wait. They stuck me 7 times in 5 different places, trying to get an IV and then to get blood work. So that wasn't pleasant. I didn't cry, even though it hurt a lot. I did cry when the nurse was asking me why we only had 1 kid, because my postpartum was so bad that I was seeing and hearing things, and I think my son deserves a living mother more than he deserves a sibling, because we don't need that in the house. We don't need to go through this again. And finally got to see my doctor 20 minutes after surgery was supposed to start, but that's fine. I don't know if the surgeries before her went long. She had me sign some more consent forms. Anesthesia came in to ask me some questions. They gave me gabapentin and a couple other drugs, which made me super drowsy. Like, I was almost falling asleep while this poor anesthesiologist was talking to me. And then it was time to go. She gave me an injection in my IV for like an anti-anxiety medication as they were wheeling me in. And again, I just started bawling, like actual crying, because I was so excited for this to be over. This bleeding has been ruining my life. So they get me in, they had me scoot over onto the operating table, and I pass out like a light. They hadn't even plugged me into anything yet, and I'm out. So the type of surgery I had was a vNotes surgery, which is vaginal natural orifice transluminal endoscopic surgery. So like I said earlier, I do not have any scars in my belly. They didn't have to put the laparoscopic stuff into my tummy. Everything went in the front hole and everything came out the front hole. So I basically birthed my own uterus. It feels like my body feels like I did just give birth. I am sore, itchy, but I don't think I feel as bad as somebody who had had an abdominal, because I don't have the shoulder gas pain. That's kind of one of the benefits, is there's only one incision, and that needs to be sutured. It's the one at the top of the vagina, the one that makes the sock. I don't have any gas pain because they didn't have to fill me up. I have a quicker recovery time because it's in a mucosis area, so it'll heal nicely. And I don't have to worry about any kind of unsightly scars. Nobody knows. If you look at me, you would not think I just had surgery. You watch me walk around, you'll know. I feel a lot better than I did the last 2 days. When I came home on Tuesday afternoon, I was dog tired. But they gave me Oxy, which I have been taking. That doesn't really work by itself, so I take ibuprofen in conjunction with it. They also gave me a stool softener, because if you are ever going to give birth, take your stool softener. It matters. It matters a lot. So they did their thing. They speculum open everything up, cut around the cervix, cut the cervix away from the bladder, and then go pop on the little vNotes thing and just start working it. They're cutting ligaments, they're cutting blood vessels, and then the whole thing comes out. So hence birth of your own uterus. I felt fine when I woke up, and then the longer I was awake, the more it started to set in. My oxycodone took a while to set in. I was in full newborn kitten mode. I could not open my eyes more than a slit. I couldn't see anything. I could barely talk. Editing Kylie here. I'm wearing the same outfit because I'm editing it on the same day. But I, again, started bawling after I was done in the recovery room, because it happened. It finally happened. I kept waiting for months for the shoe to drop and them to no, actually, we don't think you need this. So having it done, I just started weeping again. The different nurse, was so sweet. I asked her name twice. She even showed me her badge, and I cannot tell you her name. I think it started with a C. But they clothed me. They gave me a big old pad, which I haven't really it's not a lot of blood. It's actually pretty minimal blood for what is happening. And a little bit of blood clotting, but a tiny bit. So she force-fed me gently force-fed me Jell-O so I could take my pills. And she called my husband, and then I was asleep in the chair while she was wheeling me out to my husband in the front of the hospital. And then I went home and I slept. I've been in bed most of the time last 2 days. I do get up to have to kind of putter around, make sure the blood flow is good. They are worried about blood clots in my legs, because when you are in there, you are semi-inverted. So your head's down here, your bottom's up here. That way they can see. And it also brings all those organs down towards your noggin, because anatomical drawings are not reality. It's a lot more layered than that. So as for pain right now, my pain's being pretty managed by these. I think I'm doing really, really well. I'm staying hydrated. Editing Kylie again. I forgot to mention this. I had a catheter, obviously, while I was in surgery. And so for the first 10 times I went pee after I got home, it was like pissing glass. It hurt so bad, to the point that I found myself kind of withholding so I could avoid it. It hurt so bad, and I just want people to know that, because I had never heard that before going on this journey. I haven't been eating that much because I'm just not that hungry. But also I haven't been able to poop. TMI, but if you're here, you're willing for the TMI. But it's crazy to go from like bleeding out of these 3 products, 2 ultras and a super, in 6 hours, completely bleeding out, to I'll never have a period ever again. Like, that is so crazy. I'm so excited and I'm so happy. If anyone has any questions about the vNotes or the vaginal hysterectomy specifically, go ahead and comment. I am an open book if you have any questions. I'm probably going to do either like a 3 months or a 6-month follow-up on this, and that'll be it. I'm not going to make this all my content. But if you like sewing and cooking and reading, like, comment, and subscribe, because it's a fun ride. I'm having a fun time. And this is the biggest change that I've gone through besides having my son. And I think this will be genuinely life-changing once the pain goes away. So, good luck to anyone who's trying to have this too. Bye.